Welcome to the channel. Subscribe or like if you like it. Today we will explain the active principle Clopidogrel, its side effects, its doses, contraindications, warnings, mechanism of action, intentions, pregnancy and breastfeeding. What is Clopidogrel? And what is Clopidogrel used for? Clopidogrel is a medicine used for the treatment of acute coronary syndrome, heart attack, ischemic stroke, myocardial infarction, prophylaxis, percutaneous coronary intervention, peripheral artery disease, transient ischemic attack. Clopidogrel is marketed by Bristol Myers Squibb and Sanofi Aventis under the trade name Plavix, by Sun Pharmaceuticals as Clopidogrel, by Ranbaxy Laboratories as Cerebrovascular, and under the name Plavix by Intis Pharmaceuticals, Clodion by Gobi Novog, and Clopidogrel by Bayer Laboratories, as Clopres by Lab. Pharmatech. Mechanism of action of Clopidogrel. A prodrug that inhibits platelet aggregation by inhibiting the binding of ADP to its platelet receptor and the subsequent activation of the ADP-mediated PIB-FIA complex. Therapeutic indications and dosage of Clopidogrel. Oral route. In adults, prevention of atherothrombotic events in 1. Patients who have recently suffered a myocardial infarction, from a few days before to a maximum of 35 days, cerebral infarction, from 7 days before to a maximum of 6 months, or suffer from established peripheral arterial disease, 75 mg in 24 hours. 2. Patients who present acute coronary syndrome. Acute coronary syndrome without ST segment elevation, unstable angina or non-wave myocardial infarction, including patients undergoing stenting after percutaneous coronary intervention, combined with ASA, loading dose, 300 mg, follow with 75 mg every 24 hours, plus 75 to 325 mg/24 hours of ASA, 12 months maximum. Acute myocardial infarction with ST segment elevation, which are candidates for thrombolytic therapy, in combination with ASA, start with loading dose, 300 mg plus ASA, with or without thrombolytics, continue with 75 mg every 24 hours, minimum 4 weeks. Over 75 years of age, start without loading dose. Prevention of atherothrombotic and thromboembolic events, including stroke, in adults with atrial fibrillation who have at least one risk factor for vascular events, who are not eligible for treatment with vitamin K antagonists and who have a low bleeding rate, in combination with ASA, 75 mg every 24 hours, plus 75 to 100 mg/24 hours ASA. Mode of administration of Clopidogrel. Oral route. Single daily dose with or without food. Side effects and adverse reactions of Clopidogrel. Hematoma. Epistaxis. Gastrointestinal bleeding. Diarrhea. Abdominal pain. Dyspepsia. Bleeding instead of injection. Contraindications of Clopidogrel. Hypersensitivity. Severe liver failure. Active pathological bleeding, for example peptic ulcer or intracranial hemorrhage. Warnings and precautions with Clopidogrel. Patients at risk of bleeding from trauma, surgery, gastrointestinal and intraocular injuries, etc. Increases the risk of bleeding administered along with ASA, heparin, glycoprotein IB/FI inhibitors, NSAIDs, SSRIs, other medications such as pentoxifylline, thrombolytics, oral anticoagulants. Suspend 7 days before surgery. Risk of thrombotic thrombocytopenic purpura, fatal, hemophilia acquired after administration of Clopidogrel. Stop treatment. Allergic cross-reactivity. Assess for history of hypersensitivity to thienopyridines and monitor during treatment. Renal failure, moderate liver failure. Do not use in children or adolescents. Not recommended for 7 days after acute ischemic stroke. Concomitant treatment with CYP2C8 substrates, for example ripaglinide, paclitaxel. Liver failure and Clopidogrel. Contraindicated in severe liver failure. Caution in moderate hepatic insufficiency, due to hemorrhagic diathesis. Renal insufficiency and clopidogrel. Caution due to lack of experience. Clopidogrel interactions. Not recommended with potent or moderate inhibitors of CYP2C19, omeprazole, esomeprazole, fluvoxamine, fluoxetine, moclobamide, voriconazole, fluconazole, ticlopidine, carbamazepine, efavirenz, ritonavir, and cobicistat, as they may result in reduced levels of the active metabolite of clopidogrel. The concomitant use of clopidogrel with pharmacokinetic enhancers of antiretroviral therapy is discouraged. Pregnancy and clopidogrel. Since clinical data on clopidogrel exposure during pregnancy are not available, it is preferable not to administer clopidogrel during pregnancy as a preventive measure. Animal studies show no direct or indirect harmful effects on pregnancy, embryo-fetal development, delivery or postnatal development. Lactation and clopidogrel. It is not known if clopidogrel is excreted in human breast milk. Animal studies have shown that clopidogrel is excreted in breast milk. As a precaution, breastfeeding should be discontinued during treatment with clopidogrel.